Chemotherapy is a treatment that uses drugs to treat cancer. It can be given to treat the primary tumour, reduce the risk of it coming back, or control the cancer and help relieve symptoms, improving quality of life. The usual drugs used are cytotoxic, that is, they kill both cancer cells and healthy cells. Other drugs, such as antibodies, can be used, which specifically target cancer cells depending on the individual's needs. There are more than 50 different chemotherapy drugs which can be given on their own or in combination. The drugs given depend on your diagnosis, stage and/or age. Chemotherapy can be given before or after surgery or radiotherapy. In some situations, chemotherapy can be given with radiotherapy. Chemotherapy can be given in many different ways, but most commonly it is given into a vein in tablet form or into the spinal fluid. Most often, chemotherapy is given into a vein by a cannula. It can be given in the day unit, which takes between 3 and 8 hours, or the inpatient ward. If it is difficult to site a cannula or the duration of the treatment indicates it, a central line may be indicated. These include a PICC line, Hickman line and portocath. If one of these lines is indicated, it will be discussed in more detail by your specialist nurse. All cells, including cancer cells, divide and replicate themselves. Chemotherapy interferes with this process. Drugs travel in the bloodstream and therefore reach cancer cells around the body. The cancer cells take up the chemotherapy drugs from the bloodstream. Chemotherapy also affects normal cells, which lead to side effects such as sore mouth. Normal cells usually repair themselves, but cancer cells do not have that ability and eventually die. Damage to normal cells usually is temporary and disappears over time when treatment is finished. Different drugs work in different ways and can be used in combination because of their different effects. When the drugs are given is carefully planned to maximize the effects of the chemotherapy drugs and minimize the damage to normal tissue and therefore the side effects. If you have decided to have chemotherapy, you will be given an appointment for either the day unit or the inpatient ward, depending on the duration needed to give the chemotherapy drugs to you. Before you start, some tests will be done to ensure that you are well enough for treatment. It is routine to have chest X-ray, ECG and blood tests done. The blood tests taken check your white cells, red cells and platelets. The importance of these will be explained later. Your liver and kidney function is also assessed. These blood tests are repeated before each cycle of chemotherapy and usually take about an hour to process. Some drugs will necessitate further tests such as hearing tests, a special urine test and an ultrasound of your heart. Side effects of chemotherapy drugs occur because the action of chemotherapy is not specific to cancer cells. However, normal cells usually recover after the treatment is finished. If you become unwell in any way while on treatment, it's important to contact your specialist nurse, day unit or inpatient ward rather than your GP. We aim that you will continue your life as normally as possible while on treatment. Chemotherapy can reduce the number of blood cells produced by the bone marrow. Bone marrow is a spongy material that fills the bones and contains stem cells. From stem cells you get 3 kinds of blood cells. White blood cells are essential for fighting infection. Red blood cells contain hemoglobin to carry oxygen around the body. Platelets help to clot the blood and prevent bleeding. Chemotherapy drugs can lessen your resistance to infections. This happens because most chemotherapy drugs affect the bone marrow where white blood cells are made. If you don't have enough white cells, even a minor infection such as a cold or a sore throat can make you ill. White blood cells influence your natural ability to fight infection. Therefore, when your white cells are low, usually 7 to 14 days following treatment, you are at a greater risk of infection. This does not mean you cannot continue your normal activities. You must look after yourself though during this time and be alert to the signs and symptoms of infection. These symptoms could be sweating or chills, feeling hot and or cold, a burning feeling when you urinate, a cough or sore throat, unusual vaginal discharge or itching, redness, swelling or tenderness, especially around a wound, sore, pimple or intravenous catheter, abdominal pain and or diarrhea. You must contact the day unit or inpatient ward rather than your general practitioner if any of the symptoms occur. Also note that occasionally symptoms may be absent and you may feel generally unwell. Take your temperature if you feel unwell. If your temperature is 38 degrees centigrade or above, or 35.5 degrees centigrade or below, you must contact the day unit or inpatient ward. Do not take paracetamol or other medicines containing paracetamol. Always read the label. Paracetamol falsely reduces your temperature for a few hours, and this delay can mask a serious infection. Red blood cells carry oxygen around the body. If the level of red blood cells is low, you may feel tired, weak, dizzy, lightheaded, and muscles and joints can ache. Some people will feel breathless. These are all symptoms of anemia. Your blood tests will be routinely checked throughout your treatment to measure your hemoglobin. A blood transfusion can be given if your hemoglobin is low. These extra red blood cells will quickly pick up the oxygen from your lungs and take it around the body, helping you to feel more energetic and less breathless. If the number of platelets in your blood is reduced, you may bruise very easily for no obvious reason. This is because platelets help to make your blood clot and stop any bleeding if you hurt yourself. You may suffer from nosebleeds or bleed more heavily than usual from minor cuts or grazes. It is important that you contact the hospital if you notice that you are bruising more easily or notice any red spots under the skin which can look like a rash. You may need to attend hospital and have a platelet transfusion, which will start to work immediately to prevent bruising and bleeding. Men should use an electric razor during treatment to lessen the risk of bleeding.